Hello, friends. This video concerns delirium that comes from having a urinary tract infection. I'm sharing with you what I found out while searching for research on possible treatments for this debilitating condition. I'm Linda Miner, and this is our cat, Kitty. Okay, this is my disclaimer that you might want to read. I am not a medical doctor. I am not giving you medical advice. That's basically it. But this is information on what I discovered as I was doing some research. Here's an article which might be of interest to you. It is a systematic review of delirium in elderly patients. UTIs account for about 15.5% of hospitalizations in the elderly and over 6% of deaths that are due to infectious disease. Among the elderly, those with UTIs, about a third had delirium symptoms. Length of delirium is associated with hospitalization or longer hospitalizations. Longer-lasting deliriums can also lead to the development of dementia and even mortality. Here was an interesting finding in that same article. Early treatment with antibiotics when there is the bacteria for UTI, but it's asymptomatic, the person doesn't have any symptoms, that early treatment can precipitate delirium. Delirium generally can last from a day to several weeks, and most people do recover. If it lasts, it can cause or lead to dementia, or even make existing dementias worse. If severe enough, it could become permanent. It can also increase the risk of death. The person with delirium can become quite confused, can become delusional even, thinking things have happened that have not, remembering things incorrectly, or not being able to do things that the person has always known how to do, like being able to work a TV remote or their computer. They might forget how to go to the bathroom, how to put on their clothes, might sleep too much or not much at all. They might become paranoid. It's just a debilitating general confusion. I will put the data article in the description, so if you want to look it up, you'll be able to. This is an article by Rationale et al., and I'll also put that in the description. They talked about interleukin-6, IL-6, that might be implicated in delirium with UTI. And they hypothesized that IL-6 is increased in the brain and floods the brain, particularly in the hippocampus and the frontal lobes. And maybe by inhibiting IL-6, the delirium could be reduced. This article discussed mice, which are not humans, of course. But my husband is a geneticist, and he always said that there is a lot of similarity between mouse and human protein coding genes. In fact, about 50% or more. So that means that mice can be valuable in doing research for humans. And I wanted to know what could inhibit IL-6. Okay, there was an interesting write-up that came out of that Rationale et al. Article, and they looked at mice with and without UTIs. Those with the UTIs had deficits in their short-term memory and structural changes in their brain. I don't know what kind of short-term memory they used, but whatever it was, they found that too much IL-6 induced delirium-type behaviors. And they treated some of the mice with anti-IL-6 antibodies, and those mice became normal. Even the anatomical changes came back to normal. They concluded, quote, treatment with anti-IL-6 antibody in the UTI group normalized all the brain changes, both structural and functional. Lahiri said, quote, a wealth of studies have shown a link between IL-6 and delirium, but only this study and our previous study have shown that IL-6 may play a direct pathological role in delirium, unquote. Found this article by Harahap et al. Investigating black seed oil. And they were looking at some of the biochemical, bioactive compounds that could significantly lower interleukin 6. This was a controlled study, which is good. However, it was with rats. But they did find and concluded that giving black seed oil either alone or with ceftriaxone was effective in reducing IL-6 level within 7 to 14 days. Now, without human studies, it might be difficult to get an IL-6 antibody from a doctor for treating a loved one. However, a supplement is a different matter. Before using any supplement, one should look up black seed oil to find out what the normal dosage of it is and whether or not it could interfere or interact with any of the medications that the patient is taking. This could be discussed with one's doctor to know if the supplement would interact with anything the patient were taking. Again, I'm not giving medical advice, and it's best to talk with your doctor. But given the articles above, I would try black seed oil, even not knowing if it would work for certain, since it would likely not be harmful, but only if it would not interfere with any medication my loved one were taking. If the supplement seemed to work, could this be the result of a causative relationship or just a fluke? One would not know for certain without doing controlled research. Now, I wish I had some human studies to cite, but I don't. I can't find any, and I don't think any have been done. But it would be interesting if a controlled study were to be initiated. If it were helpful, it would be good for people to know about. So that's the end of my study on this one, and I thank you very much for watching this video.